Welcome you to this video. The purpose of this short presentation is to share with you about some practical and technical issues around the new tracheal intubation technique during the COVID-19 pandemic and probably beyond. It is about the use of plastic sheet as a physical barrier to protect the intubators from being contaminated while they are applying intubating stylet or laryngoscope on the scene. Since the outbreak of the COVID-19 in 2019 and the following pandemic, there have been huge casualties and the loss of lives caused by this cunning, treacherous, and unpredictable silent pretender, the coronavirus. Among all the aerosol-generating procedures, tracheal intubation draws a great attention to the professionals in the front lines. We are sure that you are already familiar with all the relevant risks related to such virus transmission, that is, mainly by contacting patients' contagious body fluids. The risk factors include the respiratory droplet spills and splash, and the aerosol spreading to the surroundings, the mode of transmission via inhalation, deposition, and even touching the fluids left over any surface. The chance and severity of being contaminated depend on the distance between the intubators and the patients, the amount of patient's fluids, and the timing of the procedures. Most important, the incidence pretty much varied with the adopted tracheal intubation strategies and the techniques. The professional societies have reached the consensus guidelines for managing the airway in patients with COVID-19. Clear enough, the tenets of such airway management include the tracheal intubation procedure itself must be smooth, not only swift. To put the tube correctly into patient's trachea, but not the esophagus, both the patient and the intubator are eventually safe. No one should be hurt. It cannot be overemphasized here the importance of the checklist of the preparatory actions in managing airway in COVID-19 patients. Those include Team Up Airway Task Force, set up and follow the policies, procedures, and guidelines. The professionals should have enough knowledge, skills, and proficiency on airway management. Lastly, in addition to having concept, the professionals should have the courage and caring for the vulnerable and helpless patients. Finally, before entering a negative pressure room, the airway team should complete the status evaluation, check all the details, and go through them, wear the effective and adequate PPE, prepare appropriate intubating tools and medications, and make sure the Plan B always be there. Why using video-assisted intubating stylet? Our answer is an easy one. Why not? By looking at this figure, one might already have a better idea about why using video-assisted intubating stylet in comparison to using conventional laryngoscopy and video laryngoscopy. Among all the comparisons, please mind the distance between the intubator and the patient. Yes, the safety distance or social distance really matters. How many different brands of the video-assisted intubating stylet in the market? Not surprisingly, there are many enough brands of video-assisted intubating stylet available, accessible, and affordable out there in the market. Be my guest. PPE surely is a prerequisite for the intubators. No question about that. However, due to the scarce and limited medical resources at the different regions and in the countries around the world, not all people can get high quality and luxurious PPE, for example PAPR, shown in this slide panel A. Therefore, to accommodate the individual constriction medical resources status, one needs to find their own way, a compromise but maximize protecting manner against the possible contamination during the tracheal intubation procedure. for example shown in this slide, panel B and C. Here, in addition to PPE, we proposed an ancillary protection method by using a piece of plastic sheet functioning as a physical barrier between the patient's airway and the intubator. One can easily make such a piece of plastic product, or a commercial one is also available. Here we made a piece of plastic sheet specific use as a barricade against possible contamination during tracheal intubation. It is 60 centimeters by 60 centimeter square sheet. There exist 2 holes in the marked area. The cross in the blue circle is designed for inserting intubating stylet, and the red one is for the use of a suction tube. If one prefers video laryngoscopy, this sheet is also applicable for its use. After the completion of intubation, one can easily split apart the sheet along the predefined seam line, indicated as the dotted line within the blue band area. This is a view of an actual product of such plastic sheet. This slide shows an intubating stylet was inserted through a tiny hole over a plastic drape, Tegaderm film dressing in this case, which covered the marked area. A suction tube is for the optional use. For example, if the patient's secretion really creating an apparent problem. Use of a Yankow suction tip is also possible. This is Qizang. For those who are passionate about using laryngoscopy, the 2 holes design here also fits for this purpose. It is worth mentioning that a disposable laryngoscope blade could damage and crack the adhesive film, which is supposed to minimize any leaks or spills of the secretion from the patient's mouth. Therefore, to correct this failing, one needs to insert laryngoscope camera module through the hole first, and then slide in the disposable blade over the module from the inside of the sheet. That is another way around. In this way, one can keep the Tegaderm film intact. One might argue that the full coverage would provide better protection. On the other hand, one should always keep in mind, after completing intubation procedure, the disposal of the barrier device itself might also cause further contamination. Therefore, a proper size of the plastic sheet should be large enough to cover the area at risk, and not too big to cause unnecessary risk of contamination. One needs to practice how to safely retrieve and dispose the plastic sheet into a medical waste trash bag. Some intubators found the flood of secretion from the patient's upper airway are annoying. Therefore, it should be mentioned that the medications and the induction agents should be administered wisely. With the advantage of using intubating stylet, there is a better chance that the patient suffers less stimulation during the procedure in comparison to the laryngoscopy. Here we believe a prior smooth and effective suctioning inside the patient's oral cavity to minimize secretion and sputum provides a better view for later advancing the intubating stylet. Again, one needs to follow the consensus guidelines, which recommend a deep sedation and an adequate neuromuscular blocking condition should be achieved before conducting tracheal intubation in patients with COVID-19. By any means, one needs to minimize the stimulation caused by the tracheal intubation procedure. Also, it should be stressed that the timing to proceed the airway procedure is important in order not to cause coughing or bucking. Some opponents will argue the dirty stylet tip will cause a serious problem. Indeed, the stylet tip is never clean under this condition. One should adopt all the measures to clean and disinfect the stylet after intubation procedure. Also, a plastic protective sleeve is helpful to wrap up the stylet while retrieving it from the endotracheal tube. Kind of a hands-off design. This is an example of a homemade plastic protective sleeve over the entire length of the stylet. Although the stylet could also be disposable, a trade-off with price, of course, to appropriately clean and disinfect is not difficult on the other hand. This slide shows our own practice on cleaning and disinfection, 5 steps, which apparently are not too exhausted. Some opponents would argue whether the plastic sheet could prevent airborne viral particles. Unfortunately, the plastic sheet barrier has never been designed as a barricade for airborne contamination. Instead, the plastic sheet design is only for the larger size of aerosol particles, not for much smaller ones. We have demonstrated this issue before. Size of the particles does matter. In summary, the plastic sheet is not for airborne particles. Instead, combined use of plastic sheet and video intubating stylet is practical and effective. The goals of smooth, accurate, and safe are satisfactorily met. In contrast to other barrier designs, the plastic sheet itself does not create a risk if any airway emergency occurred. The plastic sheet will not endanger teammates to be contaminated by the barrier itself, which is important. Finally, PPE is prerequisite in any case. No excuse not to wear it. We hope this video provides a different view on the roles of plastic sheet barrier and the video intubating stylet in patients with COVID-19. Thank you for your watching. Godspeed.